Hi everybody, my name is Dr. Jonathan Kuttner. I'm a musculoskeletal pain specialist. I'd like to discuss neck pain, which is really common. And the first thing that I'd like you to note, because here's a spine, is that in the lumbar spine you've got a huge disc and tiny joints. In fact, the disc carries over 80%, 85% of the weight, and the joints only 15% of the weight. But when you come up to the neck, the disc is a lot smaller and the joints are huge. And the disc carries less than 50% of the weight and the joints over 50%, 55%. So therefore, when you look at chronic neck pain, the joints, and these are these tiny little facet joints, which look small, but remember in the neck, they're very important. They become injured more commonly, and therefore the treatments that we're going to look at are treatments to free up the joints of the neck. Now, traditionally, people have gone to chiropractors who probably the last, if you took 10 or 15 years ago, primarily treated the neck by manipulations. Those are big movements. And the movements, the click or the crack that you hear is a movement, is a sound from the facet joint as it becomes gapped. So, and millions of people have had, maybe hundreds of thousands of people have had millions of manipulations of their neck. Now, the majority of people who have a manipulation feel some relief, but, and this is the thing that I really want to talk about, the problem with the neck is that it has a structure in it which is nowhere else in the back. And that structure is this, this is a artery which runs curling its way through the structure of the neck, coming right up the top and winding out over the top cervical vertebra into the brain. This is called the vertebro-basilar artery, and the problem is that if you have manipulations of your neck, and a manipulation is that you have a rotation and a force applied which takes you beyond your comfortable range, the movement that you'd normally do would stretch it a little. But if somebody else has got your head in their hands and they do a thrust, they will move beyond into a zone that you would never normally go. Now, what that will do is that it'll open up the joint, which may reduce the pain and the tension in that area. But the problem is, and this is rare, however it's unpredictable, that in doing that, they may actually stretch and damage this little artery. This little artery and that little artery, these two together, supply a quarter of the brain's blood supply. So if you are one of these very unlucky people where this artery is damaged, you may end up with a stroke, or in the worst case scenario, you may actually die. So this is something really important to think about, and that's why what I'm going to teach is a beautiful, elegant, effortless way of mobilizing, of freeing up these joints in a way that is for you the movement is subtle, but you can feel it very clearly. The person that you're doing it to will feel it very clearly, but there will be no pain and there will be no danger. And so this is what I think is so important when it comes to treating the neck. That's the joints. The second commonest cause of pain in the neck is muscles that have gone into spasm or trigger points. And so the second thing that I would like to teach is how you can treat these trigger points in, again, another lovely, elegant way. It's called a torsional release. And doing these two things will, in fact, relieve the majority of people's neck pain, because the two most common causes of pain in the neck, often which go together, they like dance together, are problem with the joint, which then sends messages to the muscle to say, protect me. The muscle goes into spasm, and they become a self-feeding loop of spasm and pain. So being able to free the joint up and turn off the trigger points is incredibly effective, and both of these are painless and completely safe. So if you want to learn more about these, just follow the link below. Thank you.